So have a seat, have your equipment ready. Have a seat at the base of the OOV. And then just kind of have the weights ready and have the ball nearby, but allowing your tailbone to sink into the OOV. Gently let your arms rest by your sides. Press your feet firmly into the floor. Maybe lift all the toes up, spread them apart, and then relax them down. And start taking deep breath. Maybe place your arms on the outside of the ribs. Close your eyes for a second. Inhale, allow the ribs to expand outward. And then as you exhale, start thinking about activating transverse abdominis, connecting that bungee cord from hip bone to hip bone, creating that internal core set system. The next breath in. And as you exhale, turning on deep core, start connecting to the pelvic floor. Just a little bit of that lift up. Again, breathe in. Relax everything, allow the ribs to expand. Now let's knot the chin as you exhale, lengthening through the back of the neck. With the next breath, we're gonna take another deep breath and just hold it at the top. And then as you exhale, turn on transverse abdominis, pelvic floor lift, gentle chin knot. And we're gonna start grabbing our weights. Now, before we grab the weights, take the ball and place it underneath your right foot. It just could be any small ball, but as you push it down, now bring both arms up towards the ceiling. Finding balance within this posture. So having the foot on the ball will help activate that hamstring a lot more. Now we're gonna press that foot into the ball and let it lengthen away. And then bring it back in. So just starting with gentle heel slides. One more time, let that leg slide away. And then bring it back in. Final one with the heel slide. And coming back in. Now we're gonna add arm movement. Both arms reach overhead as the leg slides away, not the chin. Breathe in. Exhale, arms come back, heel comes back. 3 more just like that. Inhale, arms reach overhead, leg lengthens. And exhale, everything comes back in. And 2. Inhale out. Exhale in. And last one. And coming back in. Now, opposite arm from the ball is going to go out to the side as the leg extends out. So you roll the ball away through the heel slide and let opposite arm fall out to a T. And then bring everything back in together. We're gonna do 4 more of this sequence. The focus is stability. So we're gonna move real slow. Trying to quiet any kind of shift on the OOV as much as possible. Breathing in as we move away and exhale as we come back in. That's great. Excellent. Let's pause. We're going to take the opposite arm from the ball down onto the floor. So the elbow is gonna stay down. Opposite elbow, opposite foot is on the ball. We're gonna bring the free leg up into the tabletop. Now from here, we're gonna keep our elbow and the foot on the ball, and we're gonna move opposite arm, opposite leg away from each other. So we'll lengthen out and exhale as we're coming back in for 5. Inhale out, exhale in. If this is too easy, bring the elbow off the floor. Hopefully feeling the hamstring that's on the ball. Feeling core, you can try taking the elbow just slightly off the floor, kind of unweighing it. Pulling ribs in as arm and leg move away from each other. And last one here. And then we're going to lower that leg down, lower the arm down, and switch the ball to the other foot. So take a second to reposition. We're going to start by pushing that leg into the ball and just doing a couple of heel slides to make sure everything is in the right spot. Rolling through the ball, lengthening through the hip. Now it's very important that you don't feel any clicking in the hip. If you do, definitely let me know. May have to bias more towards imprint of the spine. We want to allow the psoas to lengthen and then shorten without any clicking. Now let's reach both arms up to the ceiling. And as the leg slides away, you're going to reach your hands overhead, not in the chin at the same time, pulling ribs down. And exhale, coming back in. 3 more. Pressing into the ball, arms reach away, elbows are straight, not in the chin, the back of the neck long. And coming back. Inhale out. Exhale. And out. Breathe in. Last one. Now we're going to take opposite hand out to the side as the ball slides away. And pulling the ball in, bringing hand back. Now as you take the hand out of the side, make sure that the palm is facing up. Even so, to make it even harder, add more external rotation by the thumb facing down towards the floor. So as you open the hand out to the side, you rotate your arm so the thumb is facing down to the floor. So it's external rotation of the arm as that arm opens. Adding even a little bit of that rotation makes a difference on shoulder stabilization and rotated cuff work. Good. Now we're going to bring the ball in. Both arms are reaching up. Opposite elbow is going to go down onto the floor. So if it's opposite elbow from the foot, so up, one foot on the ball, opposite elbow on the floor, we're going to bring the other leg up into tabletop. Now we're going to start moving arm and leg away from each other that are free in the air, that are not touching the floor, and coming back in. We're doing about 5 of those. Breathing. Excellent. Lisa looks great. Chinky, great mobility through the shoulder. Good, last one. And coming back in. Let's lower that hand down and lower the leg down. So we're gonna drop the weights, put both arms onto the floor, move the ball out of the way, And we're gonna do last one where both legs come up towards tabletop. So abdominals are connected, a little more imprinted position here. Nice long neck, shoulders away from ears, arms are down on the floor, heels together. We're gonna press our heels together a little bit and open knees out to a diamond. Kind of like a clamshell position here. Now keep a little bit of that squeeze through the heels and let's flex the toes and the ankles. We're gonna breathe in to prepare. As we exhale, let's reach both legs long, pointing through the toes, and flex the ankles as we're coming back in. So we have 4 of these. These are hard. Exhale, squeeze heels together, lengthen away, and inhale as we're drawing it back in. And 2. The lower we go, the harder it is. And 1. So you're really pulling your core in as the legs reach out. Now let's stay in this position, heels together, toes apart, arms are down. We're gonna start going into heel taps. One heel will lower down, and you can keep a little bit of that lateral rotation and bring it back, and the other. Back. Inhale, lower, abdominals pull in. Arms can stay on the pelvis. Keeping slight external rotation in the thigh just biases a bit more of that iliopsoas. It's a slight external rotator. One more time, side to side. And bring it in. Let's lower one leg down and the other. And before we come off, we're gonna do a full body stretch. So you're gonna scoot down on the OOV, all the way down to where the tailbone is almost touching the floor, but it's off the floor. So the big fat part of the OOV is along lower back, and the pointy part is right where the neck is. So we're supported in our curves. And then just straighten both legs and straighten both arms overhead. And we're just gonna stay here and take a couple of deep breaths. This creates an extension through the front of our torso. It's a supported extension. Hopefully it feels good. If it's too much load in the lower back, you can keep your knees bent. With the next breath, we're gonna nod the chin, circle the arms, and start slowly coming back down. We're gonna go into the abdominal series, and then we'll do thoracic opening. So we're gonna flip our OOV around and have a seat in the saddle. Now we're gonna take that ball and put it between the knees to start. So legs are parallel, and you're nice in this good seated position. Arms go on the outside of the knees. And let's just start with a little bit of a pelvic shifts, letting one sit bone go down to the floor, the torso side bends the other way, and then the other sit bone drops on the outside of the saddle of the OOV. So just kind of gently moving side to side. This actually is great if there's any kind of buildup tension in the pelvic floor, sort of working on the outside of those ischial tuberosities. And you want to feel equal amount of mobility from side to side so that their pelvis can kind of shift. And then let's find ourselves in the middle, adding a ball squeeze, that inner thigh connection. Arms will start reaching forward. We're going to plug our shoulders down and back. Breathing in and exhale as we half roll back into the OOV, squeezing the ball in. Let's roll back until that lower back is in contact with the OOV, and pause here for a second. I'm gonna check in, pull our ribs in, scoop our abdominals a little bit more. Nice long neck, arms We're gonna start with 8 ball squeezes. Squeeze and release for 8. Exhale. 7 and 6 and 5. As you squeeze, abdominals pull in even a little bit more, trying to create more of the C curve with the lumbar spine. And 3, 2, and last one. Breathe in. Exhale, we're gonna roll back up into that seated position. Now we're gonna do 4 rollbacks. Exhale as we half roll back. Inhale, we lift back up. And rolling back, using glutes first and then abdominals to create that flexion of the lumbar spine and the pelvis, and then coming back into the neutral. Most importantly, focusing where the neck is, so the chin stays gently nodded and we're not pulling forward with it, keeping the length in the back of the neck. Excellent. Last one, we go back in. We're gonna stay here. Both hands will go behind our head. So we're gonna interlace them together, elbows are wide. Squeeze in the ball. We're gonna go into oblique crunches. Breathe in. Exhale, we're gonna twist to the left and lift up. Back into that neutral. And exhale, roll back down. So stay rotated. We're gonna go for 6. And exhale, up and lift. Inhale, back to neutral. And then roll back. Exhale, rotate. Inhale, lower back down. Last 2. Squeeze in the ball. Twist and sit up. And then go back. Let's switch sides. So we're in a C curve on the OOV. Breathe in. Exhale. We're starting to twist and rolling up, sitting tall as we come up into that seated neutral position. And then we're starting to roll back through that twist back into the straight. So exhale, pulling opposite rib to the hip, squeezing the ball. Hips do not move. And back down. Most important part here is to keep hips connected to the ball so that you don't feel any hip shift forward and back. That's where the work really comes in if we're seeing any kind of asymmetries. Last 2. And last one. And lower back down. We're gonna come back all the way. Take a break. And the final one in the abdominal series. We're gonna go into kind of a little bit of a crunch pulse variation here. So breathe in. Exhale, we're gonna roll back. Both arms are gonna reach forward. And we're just gonna pulse here. So inhale, exhale, lift up a couple of inches and go back down. And 2, going for 8. Exhale, 3, this is upper abdominals. Pulling the ribs in for 4. And 5, nice. 6, 7, and 8. Come all the way up. Let's get rid of the ball. Straighten both legs, and we're gonna take this into the full roll downs. So maybe scoot a little bit more forward so that you're all the way on the edge, and then grab the weights for added work. We're gonna do 4 roll downs with different arm variation. First, breathe in. Arms are gonna go overhead. So exhale, we roll back, finding our thoracic extension. Inhale, dropping back, arms reach overhead. Exhale, start lifting the arms, nodding the chin, pulling all the way up into neutral, and then reaching forward towards the feet as far as you can, lengthening through the back of the strings. Back up and rolling down. Glutes take us back. All the way. Inhale at the top. And exhale, nod the chin, lift the head, rolling it back up. And hinging forward as far as you can towards the toes. The next two arms will go out to the side. We roll back, arms circle out to the side, all the way up and over, reach behind and overhead. Inhale and lift the arms, nod the chin, rolling back up. And one more, last one, breathe in. Arms move out to the side. And overhead, lift them up. And return to that seated position. Last, reach forward towards the feet. And come up. Let's go into the thoracic rotational work. So, still need the ball. Now, if you have a smaller ball that's kind of deflated, that would be even better. This is the only ball you have? Perfect, we'll make it work. So we're gonna put our OOV in the horizontal position. The waistline is gonna go on the inside. We're gonna start with the knees at 90-degree angle, and then the top of the arm will be on the ball, and then grab the weight for added resistance here. So I should also say, if you like to have your head supported on a yoga block or a rolled towel, this is a great place to do it. Yeah, just kind of helps to have something more in a neutral position. Exactly. And I do like, I think yoga block fits perfectly in here. I like to use it. That was great. Yeah. All right. So the arm is going to go on top of the ball in the bottom. And the weight is going to go in the front hand. So knees are stacked at 90-degree angle at the hip and the knees. We're going to breathe in, lift the arm up. As we exhale, we're going to push down into the ball and start the movement by rotating that front arm, kind of pushing forward. And then that's what starts to encourage that twist. Now stay there, breathe into the ribs, kind of think of expanding, and then exhale as we're coming back into the starting position. And again, inhale, lift the arm. Exhale, push down and forward into the ball to increase that twist. Knees are staying stacked. Think about your shoulder continuing with the spine so that you don't just let it drop back there. If it feels okay, that's all right. But our focus isn't so much the front of the shoulder stretch, but more through the ribs, through the obliques, through the waistline. And then exhale as we're coming back. At some point, you can get rid of the yoga block or the towel and kind of try and see how it feels when your head is all the way down. Again, push down on the ball. Inhale. Exhale, twist back. Breathe in as we're starting to return and restack. And last one here. And then slowly coming back in. Now for the next four, we're going to take the ball and we're going to put it underneath the top knee, and that top hip is going to be lined up, or the top knee is going to be lined up with the hip. So the top hip is just going to move straight back with that knee pushing down into the ball. The bottom hand can go behind your head for this one, and the top arm is still forward, holding to the weight. We're going to do the same thing, but now we're going to reach overhead as we breathe in. And then exhale, press that knee into the ball as you rotate back and up in the same thoracic opening. A little bit different position of the pelvis. So we're allowing some rotation to happen, but we're also keeping that adductor active to prevent further rotation. And then through that reach overhead, let the arm reach overhead and then come back to that starting position. We'll do 3 more. Inhale, reach up and over, press down into the ball. Open back. Let your head rotate, let the neck twist, and then slowly coming back in. And 2 more. Slowly coming back in. This is great for shoulder range of motion, for scapula rotation work. And the last one is back. And then we're restacking. Now we're going to drop the weight, stay in the same position. We're going to come up into a little bit of a plank. So the elbow will come up, head will stay supported, and the waistline will just, from being kind of resting on the OOV, we're going to pull the ribs in. Now, let's press down into the ball. So this inner thigh, this is what this plank is about. It's an adductor plank. We're going to keep it connected, and then we're going to try to lift our bottom hip up. The heel of the top leg can stay on the floor. That's totally fine. So the front hip will lift and lower. Lift as much as you can and lower. And lift. And 4. And 3. And 2. And last one. Lower back down. Now the top hip is going to rotate. So we're going to push down into the ball and internally rotate and then externally rotate. Feel like sometimes you might have to move that ball so that it's right where that knee is. This isn't going to feel like a lot of work, or at least shouldn't. The focus is to keep pelvis where it is and just notice how the femur twists in and out. The optimal movement is just a smooth rotation. You shouldn't feel like it's sort of like jaggedy. If it is, then this is a great exercise to fix that. And last one here. Well done. Let's get rid of the ball. We're going to go down onto the long line, and you can keep the ball wherever is convenient because we'll use it in a second. Let's go into the hip work here. Toe is nice and flexed, ankle is flexed. We're going to lift that top leg straight up. Find that glute activation. So find the nice long line. Nice head position, whether it's on the yoga block or on the hand. We're just going to hold it here. This is a good place to use yoga block if you have it. We're going to lower that leg down and lift it up for 8. And 7. And 6. Focusing on the work behind that, the kind of the hip bone. So if I have my hand on my iliac crest on the pelvis, where the thumb is and down, that's the focus, is more glute medius work here. Last one here. Now let's point the toes and start drawing circles. We're going to start by bringing the hip back, down, forward, and up. Not too big. But big enough to where your hip goes into extension. Last one. And then let's reverse. Let's go back, up, and forward. Excellent. And 4. And lengthen back all the way down. Let's come up and repeat this sequence on the other side. So, taking the OOV. Taking the yoga block or the pillow or the rolled up towel. We're going to start with laying down on your side. For this first one, I kind of like to use a rolled up towel if you have one. The arm is gonna go on the outside of the bottom hand. Knees are stacked at 90-degree position. Have a little weight here. We're gonna start with our thoracic openings. So everything is lined up, nice and forward. Make sure your neck is in the good neutral position, so not too far forward. You're gonna breathe in, start lifting that arm up. Now press down and forward into the ball as it creates rotation through your thoracic spine. And just maybe stay here for a second. Take a breath in. And exhale as we're slowly coming back. We're gonna do a total of 4, so 3 more. Inhale, lift the arm. Exhale, press down on the ball and kind of start that twist, almost like you're lifting up and twisting, and then the weight of the arm takes the twist further. And then slowly coming back as we restep. 2 more. Inhale, lift. Exhale, start pushing down and forward with the bottom arm, allowing your chest to rotate, looking away. And then slowly coming back. One side is probably going to feel more restricted. We usually are. Last one here. So to kind of work on that restriction for thoracic openings is using the breath, the ribcage expansion. So start by finding that first barrier, breathing, and then exhaling, pushing more into the ball, reaching the arm forward and allowing the weight of the arm to drop it back. And again, breathe in into the barrier and exhale, maybe gain another millimeter or so. And then slowly coming back. Now the next ones, maybe get rid of everything underneath the arm, get rid of the ball. Well, actually, let's still hold the ball here. We're gonna start reaching the hand overhead and exhale, rotating back. So here you're not really pushing down on the ball as much and rotating forward. And then coming back forward. We'll do one more time here, and then we're gonna transfer the ball underneath our knee. Now let's take the ball and we're gonna put it underneath the top knee. So the top knee is gonna go lined up with the hip. The foot can fall onto the floor. Pushing down onto the ball, keeping that hip stacked. We're gonna start inhaling as we reach overhead and exhale as we rotate back. And then through that overhead reach, we're coming back to the center. You can take the bottom hand, put it underneath the head for comfort, or keep it down. Whatever feels the most intuitive for the neck here. Then, one more time, let it go all the way back, push down into the ball. And exhale. Last one on this side. Inhale. Let your eye gaze fall along where the weight is. So you're sort of moving your head around to follow the hand. And then slowly coming back. Now let's drop the weight. Arm can go underneath the hand. And we're gonna come up into a little bit of that plank. So elbow down, head is supported. We're lifting the ribs up. Both hands are gonna go and support the neck. Pushing down into the ball. Keeping the heel up or down, doesn't matter. The bottom hip is gonna lift and lower. Your focus is to try to lift the bottom hip as much up as you can by pushing down on the ball with the top hip. not collapsing into the side. Last two. And lower back down. Now we're gonna go all the way down, kick the ball away. The top leg is gonna go into the long position. Ankle is flexed, toes are pointed up, heel is reaching away, arm is on the hip. I'm gonna find that nice long line as we lift the hip up and lower back down. And lower. Being on the OOV, don't have to worry so much about neutral pelvis because our waistline is supported, so we're automatically in neutral position. And it gives better access to the hip rotators and abductors. Two more. And last one here, we're gonna lift and hold, point through the toes, and we're starting to draw circles, extending hip back, down, forward, and up. Definitely using the bottom hip, I'm pushing down with that leg for stability. Abdominals are connected, so the back doesn't extend when the hip extends. Very important to find movement from the femur, from the socket. Last one this direction, and then we're going to go back and forward. Great way to activate. And two more. And lowering all the way down. Well done. Let's press up from here. And we're going to go more into a little bit of side line work. So going back to the other side, but now we're going to bring our OOV in this long position. Still need the ball, so we're going to lie down. The hip is going to go right into the saddle. Now our body will still be in the same position, but over the OOV. So we're going to kind of take the shape of that side bend. First, just allow your body to go into that side bend. This is for the shoulder work. So the ball will go underneath the top of our arm. So the hip is nice and heavy, heel is down. We're kind of keeping ourselves supported underneath the elbow. The heel is all the way down. And then the top arm will just be on the ball, kind of pushing forward. First part, I want you to externally rotate that hand. Push down into the ball. And then internally rotate as you kind of roll the ball forward. So we're starting with the ball right lined up across the shoulder. And then we're doing a little bit of a rotation forward and back. Maybe bring it more underneath the forearm here. Excellent. Now let's take the ball and put it on the hip in the same position where the forearm was pushing down. And we're just going to press down into the hip. From here, allowing the shoulder to depress or downwardly rotate, and then press into the ball as we shrug that shoulder towards the ear. So we push into the ball, move that shoulder down and away, and then shrug it up. So it's elevation and depression of our shoulder blade. If it feels better, you can support the head a little bit. Just kind of depends on your height and the position on the OOV. Now we're going to bring halfway in between point, press down into the ball, and do a little bit of same kind of rotation forward and back. So humeral head or the arm bone internally rotates and then externally rotates. Shoulder blade will protract forward as the arm internally rotates, and then we'll retract as it externally rotates. So these are coupled motions of the shoulder joint together with the shoulder blade movement. Good. Last one here. Judy, this will be really good for your shoulder for that side. And then we're going to come back to the center, push down onto the ball. We're going to start lifting our head, supporting it on the elbow. And then from here, as we squeeze the ball, can we take that bottom arm and reach it forward? So we're kind of in this supported plank, so to speak. Breathe in, exhale. Let's lift that plank. Inhale as we lower back down. So side crunch, exhale, lift up. Inhale, we lower back down. Push down on the ball and lift and slide. And lower. 4 more. Keeping the head back, keep a nice long neck. And 3. And 2. Down, ladies. Last one. We'll lift up, we hold. We're going to lift that leg up and hold. Hold in for 10 seconds. Kind of variation of a side plank, really, working through the same muscles, but in a much gentler environment. Lots of neck work here. So working our deep neck extensors and flexors, maintaining that shape. Last 5, 4, 3, 2, and 1. Go all the way down, take that ball, reach that arm forward overhead. You can even let it kind of be supported on the ball. Take another deep breath in, allow the body to lengthen. And then we're going to come up and repeat this on the other side. So lots of things we can do on the OOV in this position, but I chose this morning a shoulder-focused workout because I think it's really important. It's one of those joints that has so many things that can go wrong really, really quick. So we're going to start with the top arm on the ball. And so the big orange ball is perfect for this. Actually, mine is the screen one is just a little bit smaller. So I like that everyone has an orange ball here. We're going to start kind of lined up. So that's your starting position, 90-degree angle. The shoulder and the wrist are facing each other. And then we're going to start doing a little bit of external and internal rotation. So not very much, small movement, gentle pressure into the ball. But this just brings awareness to that scapula. Now we're going to grab the ball and put it on the side of our body. So the wrist is pressing down. Head can stay in the same position, a little elevated, whatever feels most comfortable. Let's depress that shoulder as we push down, move it away from the ear, and then let it shrug up. So we move it away and then let it shrug up. What you want to have here is movement. You want to have some elevation and depression through that scapula. And hopefully no clicking. I'm kind of looking for smooth. Should feel like nothing, but it can feel like a lot of work actually. Excellent. Now let's find halfway in between point, and we're going to go back into the rotation, letting the arm come forward, and then keeping pressure with the ball as it goes back. So it's internal rotation, protraction of the shoulder, and then external rotation and opening through that shoulder. Sometimes we can have issues with the neck and shoulder on one side, and then the hip and low back on the other side. And while we can think that they're unrelated, frequently they are, because it's part of the same diagonal sling system where fascial muscles are connected. Excellent. Now let's come back to that center, pressing down. We're going to bring our head in a good position, and we're going to start lifting up into the long line, pushing down on the ball, nice heavy leg. The bottom hand is going to float forward and off the floor. Breathe in and exhale with side bend. Inhale, lower. And lower. So you're kind of adding that same depression and elevation of the scapula. So you're pressing down on the ball, trying to help that lift. Halfway there. Exhale up and down. And 3. Stay with me. And 2. Good. Last one. We'll lift and hold. Let's lift that leg up to add a challenge. So we're running through the T loop, pushing down into the ball, keeping that scapula connected. Chin is tucked, head is back. Bottom hand is off the floor. Heel is reaching away, toes are pulling up. Nice long line through that torso. We're pulling our ribs in, so we're not feeling anything in the lower back. And we have 5, 4, 3, 2, and 1. Take the ball, reach that hand overhead, push down on it. Let's take another deep breath in. And exhale as we're coming back. All right, our next part is extension based. So, OOV or balance sit, whatever your body prefers. OOV gives a lot of pressure into the chest, which I like for ribcage extension, but it can also be uncomfortable. So you have the OOV. We're going to start with this position with the big part over. Now with the balance sit is just going to go underneath the pelvis. So the pelvic bones are going to go on the outside. So I'll start showing with the OOV. We're going to lie down, and we're still going to keep the ball actually handy. So we're going to lie down. The top part of the OOV is going to go right underneath our xiphoid process, kind of like right into where the ribs come together. Legs are a little bit externally rotated, pubic bone pressing down. Arms are going to reach overhead and just kind of drape over the ball. We're going to start breathing here. As you breathe in, you're going to push your ribs into the OOV really, and just notice how that pressure kind of creates opening in the back, in the upper back. Now we're going to start moving into extension. So this position is okay. Arms are nice and straight, pushing down into the ball. We're going to breathe in, start pressing down onto the ball, rolling the ball towards you and allowing the upper body to lift up. And you can kind of see where you need to be. Maybe you bring that ball a little bit further forward. So let's pause here in this extension. Pubic bone pressing down, glutes are active, shoulders away from ears. Nice long neck. Inhale and exhale, dive forward. All the way. Maybe let your head drop between the arms as they reach for the ball. So it's kind of that shoulder range of motion into extension. Inhale, we lift up. Hold the ball in towards you. And exhale as we roll back forward. This is great to do also with the balance sit underneath the pelvis. It will allow you to have more of the extension in the lower back. With the OOV, it's more upper back focused. Let's do 3 more. Inhale up, nice long neck. Exhale down. And 2. And last one. We're gonna lift up here. Now we're gonna hold. Nice long neck position. Again, we'll lift our left arm off the ball, reach it forward, thumb up towards the ceiling. Now we're gonna take this arm out to the side, still with thumb up towards the ceiling. Keep taking it out to the side. Can you reach it behind your lower back? So it's gonna internally rotate. Try to reach it all the way up your back, and then slowly unfolding it through that outer reach, bringing it all the way forward towards the ball. Lower back down, switch to the other hand. Lift it up, thumb up towards the ceiling. Start taking that arm out to the side, letting it rotate as you reach as high up your back as you can. And then start unfolding it, rotating it through, bringing it back forward towards the ball. One more time, side to side. Breathe in. Bring that hand all the way over. And back over the ball. And the other side. And through the center. Lower both hands down. Allow your body to drape forward. Bring your hand underneath your shoulders. And we're gonna sit up. Heels together, knees wide. Exhale, allow your body to sit back into the shell stretch. Let your head rest on the OOV or balance sit. Allow the back to relax. Turn your head side to side. And then come back to the center. And we're gonna come up into our seated position. And we are done.